In this video, I'm going to answer 10 of the most common questions about fibromyalgia. 1. What is fibromyalgia? Fibromyalgia, or fibromyalgia syndrome, is classified as a chronic disorder characterized by widespread and persistent non-inflammatory musculoskeletal pain. Common symptoms include widespread musculoskeletal pain, fatigue, insomnia, morning stiffness, depression, anxiety, mental slowness, and memory and attention problems. 2. How common is fibromyalgia? As of 2013, 4.2% of women and 1.4% of men had the diagnostic label of fibromyalgia. The prevalence of fibromyalgia appears to increase steadily with age in women and peak during middle age in men. Traditionally, fibromyalgia was considered a predominantly female disorder, and it was relatively uncommon for men to receive the diagnosis. Recently, however, Galvez-Sanchez et al. In 2020 noted that bias within research and clinical practice leads and has led healthcare providers to underestimate fibromyalgia prevalence in men and overestimate it in women. With newer diagnostic criteria and a less biased selection of patients, the male proportion increases to 40% or more. 3. What causes fibromyalgia? As reported by the Canadian Guidelines for the Diagnosis and Management of Fibromyalgia Syndrome, the cause of fibromyalgia is still unknown. However, a host of biological, psychological, and social factors may contribute to the onset and severity of fibromyalgia. As noted by Fitzgerald et al. In 2012, the expression of fibromyalgia may be explained by a biopsychosocial model in which predisposition, triggering, and other factors such as depression, maladaptive coping, or fear avoidance behavior contribute to chronicity. 4. How is fibromyalgia diagnosed? Previously, Wolf et al. And the American College of Rheumatology created the diagnostic criteria for fibromyalgia in 1990. This criteria included both chronic widespread pain, i.e., pain on both sides of the body, above and below the waist, and at least one portion of the spine for at least 3 months, and tenderness in at least 11 of 18 defined specific locations, classified as tender points. Although the tender point examination continues to be widely referenced and discussed, it is no longer recommended within the updated fibromyalgia diagnostic criteria. For example, Fitzgerald and colleagues state that, contrary to previous beliefs, examination of tender points should not be used to either confirm or validate a diagnosis of fibromyalgia. Currently, the 2016 revisions to the 2010-2011 American College of Rheumatology diagnostic criteria are utilized as the primary means of diagnosis. There are 2 scales involved, the Widespread Pain Index and the Symptom Severity Scale. The Widespread Pain Index is a list of 19 painful areas with a score ranging from 0 to 19. The Symptom Severity Scale includes 2 parts. The first part evaluates the severity of fatigue, waking unrefreshed, and cognitive symptoms, and the second part is a checklist of 41 symptoms, including irritable bowel syndrome, fatigue, tiredness, muscle weakness, Raynaud's, ringing in the ears, etc. Per the updated criteria, there are 3 components that need to be met for an individual to be diagnosed with fibromyalgia. 1. Generalized pain, defined in at least 4 of 5 bodily regions, i.e., left and right upper, left and right lower, and axial. 2. Symptoms have been present at a similar level for at least 3 months. 3. Widespread pain index greater than or equal to 7 and symptom severity scale greater than or equal to 5, or widespread pain index of 4 to 6 and symptom severity scale score greater than or equal to 9. In the original 2010 criteria, the final condition that had to be met was that the patient does not have a disorder that would otherwise explain the pain. However, this was revised by Wolf et al. In 2016, noting that a diagnosis of fibromyalgia is valid irrespective of other diagnoses. A diagnosis does not exclude the presence of other clinically important illnesses. Lastly, the Fibromyalgia Severity Scale is calculated by adding the Widespread Pain Index and Symptom Severity Scale scores, providing a total score between 0 to 31. A score of 0 represents no symptoms, and a score of 31 represents the most severe symptoms. Wolf et al. Recommended that the fibromyalgia severity score always be reported, and a subsequent score less than 12 might be used as a measure of improvement or of current status. 5. Are we pathologizing normal? As a brief aside, but something that should be considered, researchers have raised concerns for the diagnostic expansion of fibromyalgia. In this case, diagnostic expansion simply means lowering the bar for what classifies as fibromyalgia. Higher chances of overdiagnosis, potential overmedicalization, and pathologizing of otherwise normal human experiences become a concern when too many people are unnecessarily labeled, up to 75%, with the clinical diagnosis of fibromyalgia as reported by Wallet et al. In 2016. 6. Who should be diagnosing fibromyalgia? The Canadian guidelines report that fibromyalgia should be diagnosed in the primary care setting. These guidelines suggest that seeking a specialist for the care of fibromyalgia offers no clear advantage and does not improve long-term outcomes. The guidelines state that because the primary care physician has the best knowledge of the patient from the biopsychosocial perspective and is likely to have been managing the patient over time, the primary care setting must be the focal point for management. The guidelines also report that excessive clinical investigation should be minimized, i.e., limiting unnecessary tests and procedures, and only simple laboratory tests should be performed to rule out other identifiable conditions including hypothyroidism, rheumatic conditions, neurological disease, or drug-induced conditions. 7. Is there a cure? Currently, there is no known cure for fibromyalgia. Knowing this, the focus must shift towards developing long-term strategies to effectively cope with and self-manage this condition. Again, the guidelines state the following. The healthcare community should discourage passive health-related practices and excessive dependence on healthcare professionals. Although clinic visits may be more frequent at treatment initiation, reduction of unnecessary healthcare contact when the patient is on a stable trajectory is mandatory. 8. What are the treatment options? The European League Against Rheumatism has two primary recommendations for the management of fibromyalgia. Non-pharmacological management, including a strong recommendation for aerobic and strengthening exercise, and pharmacological management. One primary overarching principle created from the group is that management of fibromyalgia should aim at improving health-related quality of life, balancing benefit and risk of treatment that often requires a multidisciplinary approach with a combination of non-pharmacological and pharmacological treatment modalities tailored according to pain intensity, function, and associated features such as depression, fatigue, sleep disturbance, and patient preferences and comorbidities by shared decision-making with the patient. Initial management should focus on non-pharmacological therapies. As just mentioned, aerobic and strengthening exercise was the only management option receiving a strong level recommendation. The next section will elaborate on the safety, types, and prescription of exercise for those diagnosed with fibromyalgia. 9. What exercises are recommended? Multiple clinical practice guidelines and consensus groups recommend exercise as the cornerstone of treatment for those diagnosed with fibromyalgia. Exercise has demonstrated improvements in pain, physical function, and health-related quality of life in this population across a variety of modes and intensities. There's no specific type of exercise or mode of training that has to be performed for individuals with fibromyalgia. Individuals should select activities that they enjoy, have frequent and easy access to, are progressive in nature, and will allow them to work towards meeting or exceeding the current National Physical Activity Guidelines. As stated by Fitzgerald et al., in the absence of a single exercise program outperforming others, patients should be encouraged to choose an activity, either land-based or water, that is enjoyable, easy to follow, convenient, and within budget in order to improve adherence. 10. How much is too much? There is no upper threshold reported in the literature regarding how much activity and exercise is considered too much for those diagnosed with fibromyalgia. My general recommendation is to find an entry point for daily and/or weekly activity and exercise that matches your current capacity and symptom tolerance. As an example, someone just starting out may only be able to tolerate 5 to 10 minutes of walking outside a few times per day and 1 time per week of low-intensity resistance-based exercise. That same individual, months or years down the road, might be able to tolerate higher intensity resistance training and 5+ mile runs multiple times per week. Ultimately, the goal is to increase an individual's capacity over weeks, months, and years with the understanding that there will be natural fluctuations in symptoms throughout this process. In summary, here are the 6 main takeaways about fibromyalgia. 1. There is no known cause for the development of fibromyalgia. The diagnosis itself and how it is diagnosed is still called into question. 2. Diagnostic criteria for fibromyalgia has evolved over time, and the current version is based on the 2016 revisions of the 2010-2011 American College of Rheumatology criteria. 3. Due to the diagnostic expansion of fibromyalgia, there is a concern surrounding the overdiagnosis and over-medicalization of this condition. 4. There is no known cure for fibromyalgia. The focus must shift towards developing long-term strategies to effectively cope with and self-manage this condition. 5. Progressive aerobic exercise and resistance training to maintain or improve overall physical function and health status should form the cornerstone of treatment. 6. Currently, there is no specific exercise program that's recommended for this population. Individuals should select activities that they enjoy, have frequent and easy access to, are progressive in nature, and will allow them to work towards meeting or exceeding the current national physical activity guidelines. Thank you so much for watching. If you enjoyed the video, hit that like button and subscribe. Peace!